This is a demonstration of the insertion of a nasogastric tube. The nurse arrives at the bedside, professionally dressed according to the University of South Alabama College of Nursing uniform policy. Perform hand hygiene. Verifies the order and the hospital policy. Identify the patient using two identifiers, comparing the chart, name, and ID number to the patient's armband. At this time, also assess the allergies, comparing the allergy band on the patient to the chart. Explain the procedure to the patient and provide privacy. Gather all necessary equipment and place on a working surface. You will need a correct size nasogastric tube, in this case a Salem sump tube, water-soluble lubricant, tape, a 60 milliliter syringe and/or irrigation set, a cup of water with a straw, a towel, a large basin, a skin prep pad and an alcohol pad, a tongue blade, scissors, and a pulse oximeter. The stethoscope and pen light are to be in the pocket, ready for use. Don goggles. Perform hand hygiene. Raise the bed to a comfortable working height. And lower the side rail. Assess the patient's bowel sounds. Notice the nurse is moving the linens and the patient gown so that the stethoscope comes in direct contact with the patient's abdomen. Place the pulse oximeter on the patient's finger. Assess vital signs. This provides baseline data that you will need throughout the procedure. If a patient has a decrease in oxygen saturation, the NG tube insertion should be stopped until the patient's stability is determined. Elevate the head of the bed to a high Fowler's position, unless contraindicated. Establish a queuing sign with the patient in case the procedure needs to stop. Open the NG tube package. Place a dollop of water-soluble lubricant on the inside of the NG tube package. Prepare the tape. You will need 4 pieces. One for marking the NG tube measurement, which you will dog ear so that it can be removed from the tube easily. Another piece for temporarily securing the tube to the cheek. One for the final fixation to the patient's nose. This tape technique will allow the NG tube to float from the patient's nares. And the last is a small piece for labeling at the end of the procedure to place on the patient's nose. Don clean gloves. Assess and select the patent nare. You will do this by having the patient close each nostril alternately and breathe normally. Wash the bridge of the nose with soap and water or an alcohol pad. Pat dry. Now you will measure the NG tube from the patient nose to the earlobe to the xiphoid process. Notice again how the nurse is moving the gown to accurately identify the xiphoid process. Mark the distance with your piece of tape, dog earring for easy removal after insertion. Place a towel over the patient's chest. And place a basin on the abdomen to hold the end of the tube and any possible emesis. Hand the alert patient a cup of water with a straw and explain the next steps. After lubricating the end of the tube, gently insert the tube through the nostril to the back of the throat. This is the posterior nasopharynx. This may cause the patient to gag. Aim back and down toward the ear. Once the tube is beyond the nasopharynx, have the patient relax and flex his head forward. Encourage the patient to swallow small sips of water. If the patient is not allowed any water, the patient may dry swallow. Advance the tube as the patient swallows, gently rotating the tube 180 degrees while inserting. Instruct the patient to mouth breathe during the insertion procedure. Do not force the tube or push against resistance. Do not advance the tube during patient coughing, choking, or decrease in oxygen saturation, as noted on the pulse oximeter. In these instances, you would pull the NG tube back into the nasopharynx until normal breathing resumes. Once the NG tube is advanced to the marking, temporarily tape to the nose or the cheek with a single piece of tape. At this time, use a pen light and a tongue blade to check the position of the tube in the back of the throat. Now it is very important to assess the correct placement of the tube according to your hospital policy. The three ways that we will demonstrate are radiography, of course X-ray, aspirating any gastric contents, and using pH test paper to assess these contents for acidity. Secure the tube after prepping the bridge of the nose with a skin prep pad. Tape the nose in a fashion so that the NG tube floats. Taping in this way avoids any pressure on the nares. Clip the tube to the gown with an appropriate securement device based on your hospital policy. Note the exit site marking on the tube with an indelible marker as a guide for any tube displacement. On the small piece of tape previously torn, write the date and time and place on the bridge of the patient's nose. Attach to suction tubing if ordered. And adjust to low wall intermittent suction. If suctioning is not used, cap the end of the tube. If using a Salem sump tube, which this is, make sure the blue pigtail is above the level of the patient's stomach. Place the head of the bed to no lower than 30 degrees. Make sure 3 out of 4 side rails are up and that the call light is within reach. Return the bed to the lowest position and assess the patient for comfort. Clean up supplies. Remove the towel and perform hand hygiene. Now you will document the procedure, the type and size of the NG tube, the time the tube was inserted, the location, the left or the right nares, how it was secured, how placement was verified, if the tube was connected to suction, and how the patient tolerated the procedure. Also note the color, amount, and characteristics of any secretions. Now the physician has ordered for the NG tube to be discontinued. The nurse will verify the order and perform hand hygiene. Explain the procedure to the patient and don clean gloves. Always raise your bed to a working height. Before removing the tube, it's important to auscultate for bowel sounds. Position the patient in a high Fowler's position. Turn off the suction if present. Remove tape from the nose and the clip from the gown. Instruct the patient to take a deep breath and hold it. With the tube securely kinked, withdraw the tube steadily and smoothly onto the towel. Measure any drainage in suction canister, perform oral hygiene, and document. This concludes the procedure for NG tube placement and removal.